Welcome to the I Spy with My MyoY podcast. I am your host, Brittany Sierra. I am a certified orofacial myologist, registered dental hygienist, and lifelong learner. My goal with this podcast is to expand your knowledge of orofacial myofunctional disorders and to bring you up to date in current literature so that together we can get to the root of the problem. You ask, we'll answer by collaborating with true pioneers in specialties associated with the myo world. Join me on this journey as we dive into the life-altering world of tethered oral tissues and airway space. Let's do this thing. Quick disclaimer, all content expressed on this podcast are the views and opinions of the speakers and is for informational purposes only. You should not rely on this information as a substitute for, nor does it replace, professional medical advice, diagnosis, or treatment. Because every person is so unique, you should always consult with your specialized healthcare professional. Karese Laguerre is a myofunctional therapist and registered dental hygienist. Karese, like many parents, suffered in silence while her children struggled with the symptoms of undiagnosed sleep and breathing issues. One visit to a pediatric dentist changed the trajectory of their lives. Already a registered dental hygienist, Karese trained with Sandra Holtzman, Lois, Laynee, and Sandra Hornsby to establish her orofacial myology knowledge. With this initial training and numerous others, in a few short years, she has not only resolved all her children's issues, but helped hundreds of patients, children, and adults alike discover how great life can be functioning on full. Her private practice, the Myo Spot, is now a leader in the quest for myofunctional awareness and public education. Her latest published book, Accomplished, delves into how to sleep better, eliminate burnout, and execute goals. Karese's mission is to transform and positively impact as many households as possible through dynamic breath, brain, and body work. So hello, Karese. We are so very excited to have you on and so very excited to hear about, your company, everything you do, your purpose, what you believe in, all this really important stuff. So let's just get started. So, we both know as myofunctional therapists that what we see in the mouth tells us so much. So let's just talk a little bit about that first and why the mouth matters and what exactly it is you're looking for when you take that initial peek inside somebody's mouth.
Well, I want to thank you for allowing me to speak and have this platform. It's a wonderful opportunity. I appreciate being here. The mouth is incredibly important. As hygienists, I feel like in school, we got like a baseline, a pretty much general knowledge of why the mouth's important. So we all know the importance of the mouth to heart disease, to Alzheimer's, just to overall when you have diabetes, how it can reflect in the mouth. But the mouth actually has a lot more of a story to tell. And when you're looking inside of the mouth, there's various key symptoms that you can see that are going on that kind of give you a little peek into a lot of overall health outside of just heart disease. There's like a grand spectrum of things. Various things that you can look for, things like open bites, scalloped tongues, narrow arches, vaulted palates, when you have a really gummy smile. There's a lot to be said about how the mouth develops as a result of the soft tissue usage. So that soft tissue usage and proper function of the mouth can make a world of difference in overall health. And it's such an important thing that gets often very, very overlooked.
So let's talk about how you kind of made the transition from, your daily hygiene routine and, what we learned in school, and then kind of changes to your protocol or whatever you want to call it after taking, your course as a myofunctional therapy and kind of knowing what you know more. Like, are you making more referrals differently than you were before? Are you just visualizing your patients differently? So again, you talked about open bites. So, I know for me before learning from hygiene school, we see an open bite. Okay. They need to go see the orthodontist. So let's get them in there. But I never knew really to ask why they had the open bite, where the open bite came from, talking about airway, if their airway is affected. So let's talk about kind of how your role as a hygienist changed from becoming a myofunctional therapist.
It's changed drastically. I think dentistry today is very focused on teeth and what goes on with the teeth. And we don't realize that teeth don't make appointments. Teeth don't have dental insurance. Teeth don't have the jobs to support that dental insurance. It's actually a person that comes in, and that person has a whole story, a whole background. And there's so much you can dig into to figure out how those teeth came to be where they are or why they are in whatever position. My story, a lot of people's story when it comes to myofunctional therapy tends to happen because they were personally affected, either them or a family member. And my story is actually pretty interesting because I have 4 children, which in itself is already interesting. That's like a totally different topic that we can get into a whole nother time. But my 4 children had a various spectrum of all the different manifestations of these airway disorders, if you want to call them that. Well, it's a very deep story and it can be very long, but essentially I started working for a pediatric dentist who was not going to compromise. She said, if you want to work for me, I am into this airway stuff and this is everything that I need you to learn. And
right on to her.
Yeah. And so I'm like, okay, this sounds great. But the more that she talked and the more that she told me these things, I'm like, wait, like my kids have these various issues. And we tend to really just live life on a surface. Like, hey, how are you? Oh, I'm great. How are the kids? Oh, they're doing wonderful. That is a lie. Okay. The kids are doing wonderful. They hardly ever are doing wonderful. There's always somebody who's in something or in the midst of some sort of struggle. And we just tend not to talk about it. So that was a lot of my case, is that I was not talking about these issues that my children had, whether it was my son who had ADHD and was struggling for many, many years, ever since kindergarten. They've been telling me to, get him checked out, get him seen. And I'm like, he's just a little boy. That's it. That's all that is. And then it gets worse and worse and worse. And then my other daughter, she had every sleep problem you can imagine. She was a thumb sucker and a mouth breather. But on top of that, she had night terrors, bedwetting, sleepwalking, everything possible, snoring, restless sleep. I mean, you name it, she suffered with it. And this is over like her whole lifetime up until she was around 10 and we started to get these things actually dealt with. Then I had the younger two. And the younger two, we had painful breastfeeding. We had all these issues going on with their ears, multiple ear infections, throat infections. We were on a constant, they should have just put an IV drip of antibiotics into those girls because that's how frequently they were on antibiotics. It didn't make any sense whatsoever. But all of those things, even though they're different and it manifested differently, it really all came down to airway. And once I started learning that, oh man, I was deep in the rabbit hole and you can't get out of that rabbit hole.
Once you're in, you're in.
You are in. So that's completely changed the way I look at others, the way I look at, patients when I am doing clinical hygiene. When you see these things and you see these things that are in their mouths that many of my children had, whether it be this open bite or retruded mandible or tongue tie or whatever, and you say, okay, I know that you're struggling in some way with your overall health. And how can we best use, what you already have to help you recover?
All right. Very good. So one thing that I wanted to also talk about that you just touched on briefly was the tongue tie. So what are your thoughts on, posterior lingual restriction, and kind of, people coming back and saying, my child I breastfed him for 6 months. So what do you mean he has a tongue tie? How do you kind of make a parent accept or understand what you're seeing and the implications, that you're seeing happen on their life or their overall quality, and not telling them, you don't want to tell a parent, oh, well, you're wrong. I'm sorry. Yeah, you breastfed and maybe, but it really wasn't how it should have been. So let me tell you exactly what's going on here. How do you kind of handle that? Because I find that, I have these parents come in and they expect, me to just work on their tongue thrust because that's what the orthodontist sent them for, or, just something with the teeth. And then here I am talking about the tongue and how it's affecting their airway, or it may be affecting their sleep and their ability to concentrate. And they're kind of looking at me like, you're a teeth girl. Like, what do you mean?
Yeah, I know. We get that rep. We're the teeth cleaners. We're just like the teeth ladies. No, it goes so much deeper than that. And the thing is, with parents and even with providers, you just don't know what you don't know. And you figure that if you haven't heard it, then it's not an issue. So if your pediatrician didn't tell you that they're struggling, or that the tongue tie is an issue, if their speech therapist didn't tell them that the tongue tie is an issue, then there's no way that this dental hygienist tooth lady is going to come in here and tell me that my child has a problem. This is my precious child. So there's a level of denial that I think you have to overcome first, in letting them know that, you know what, this is a real struggle and it manifests in many different ways. The speech may not be affected, the breastfeeding maybe wasn't affected, but you could have issues with your child and behavioral problems. You could have issues with them having sleep problems. You could have issues that go from a wide range of things. It can be any number of things. So I try to tell my story and how, you know, it affected my children in various ways, and how I regret not knowing sooner. And had I known sooner, what I would have.
Now, did your children have to have frenectomies?
Two out of 4. So I had 50% in my house.
Yeah. But really, you know,
prevalence.
it's amazing. I've talked before that I've had, you know, women in their 60s having their tongues released, and they're like, how did I not know for 60 years that I had this? You know, and again, I think we like to call it, you know, tethered oral tissue or restriction, maybe not so much tongue tie, because people kind of just think we're talking about that anterior tongue tie that is very easily seen, very easily diagnosed. But there's so many people going, you know, missed under the radar because this restriction is posteriorly, and they're not even really knowing the whole connection and how it could affect their cardiovascular system, or, you know, acid reflux or digestion, you know, all of that. So do you want to talk a little bit more about, you know, the different health implications, any kind of, you know, whether it's tongue tie or any other kind of orofacial, you know, myofunctional disorder can have on other medical issues that people have, and they're not really linking the two together?
Yes. So the mouth is where digestion really starts. Digestion is not something that starts once you swallow something. It's really starting with the saliva breaking down enzymes, and everything in the mouth is, you know, really the origination of where we're going to start our digestive process. So with that in mind, when it comes to things like how you swallow, when it's swallowing, whether it's swallowing too much air, whether it's an improper swallow and you're not pushing the food the correct way, and then you're causing these bubbles in the stomach, and then you're getting that reflux system started up. I don't think it's a lot talked about when it comes to these digestive problems, but constipation, whether it's the acid reflux, whether it's aerophagia or swallowing too much air and being, you know, excessively gassy, a lot of these things do start with the tongue tie. If your tongue is tied or tethered or restricted, or however, you know, we're going to phrase it, when it's like that, you have an issue with being able to move it functionally. And the tongue is very dynamic. We've got, you know, 8 muscles that move it in various ways, and they're in pairs. So there's 16 in there that are moving this tongue in various ways. And if you think about any other part of your body, you wouldn't walk around with a deficiency in your muscles on your legs. If your quadriceps weren't fine, you wouldn't just walk around and be like, oh yeah, this is cool. I'm still sort of functioning. I may have like a little limp in my walk, but it's fine. It's affecting something. So when you don't have the ability to move functionally with the tongue, that's definitely going to impact the way that you are really starting and initiating that digestive process. But then you go on and you think about other ways it might impact things, such as with sleep. We all know that there is now, you know, a sleep deprivation epidemic. The CDC already called that a couple of years ago. Everybody's operating on super coffee. we need coffee, can't function without it. People are having poor sleep, or snoring is becoming like a new norm. And mouth breathing is really causing the tongue to lie low, in addition with the tongue tie and those who are restricted, who can't get it to elevate anyway, or cannot maintain that elevation naturally. That's going to be now our problem with closing down the airway and putting us at risk for sleep apnea or other sleep disorder breathing issues. So sleep and digestion, it also reflects in just breathing, like respiration. There's a lot more people who have asthma or asthma-like symptoms or any sort of respiratory problems, and they're not aware that it's really stemming with how they are breathing. With that tongue, we need it to lay high against the roof of the mouth and the palate. You've got to remember that anatomically, if we're looking at ourselves as just physical beings, the floor of the nose is the roof of the mouth. And when you have a very narrow roof of your mouth, what does that say for your nose? I mean, you're not going to oxygenate properly when we're mouth breathing. All of that air is going into the upper portion of our lungs. The upper portion of our lungs is not where the blood oxygen exchange happens. That's actually in the lower part of your lungs. So we need diaphragmatic breathing. We need to be able to respirate properly if you're going to get all that oxygen, not just to your body, but to your brain. It's got to go up there too. It affects deeply the frontal lobe, and the frontal lobe is where all of the rational decision-making happens. You can almost call it like a drunken mind, because you're just unable to inhibit all of those behavioral things that would stop you, from doing something silly. Now you've got nothing to impair you. You're just like, okay, I'll just do whatever. So it impacts in such a variety of ways. It's so very interesting to see the different manifestations and how it all really just all connects back to the same thing. We've got to take care of what's going on in the mouth.
And I think too, in terms of mouth breathing, I feel like people, a lot of, patients, whether it's adult patients or parents of young children that we see, that, we need that proper lip seal. Like, they think if the lips are just, even if they're just slightly opened a little bit, that's okay, that's still considered a lip seal. And, we know that it's not. Like, the lips need to be sealed 100%. So we want to talk a little bit more about the importance of a lip seal, because again, I'm not sure how it is for you. I get a lot of referrals my way from orthodontists to work on tongue thrust. And they come, we do the evaluation. I try to make them understand, it's not just about the tongue. Like, yes, we want the tongue resting up there. That is 100% true. But the lips need to be closed. I mean, the lips help hold everything in. So if you want to talk a little bit about the importance of lip seal, anyways, I'll let you take it from there.
It's sorry,
I can just keep talking and talking and talking and talking. So excuse me.
That's fine. I don't mind. It's so very difficult to maintain the tongue posturing where it's supposed to posture if your lips are not sealed. Even a very narrow opening, that little peekaboo lip is what I like to call it, where you have like this model-like, because if you look at a lot of advertisements, all the models have their lips open.
What's that called? Blue Steel face? Is that what it is?
Yeah.
What's that movie? It's a Zoolander.
Yes. So with those parted lips, it's very difficult to maintain anything else the way that it's supposed to be maintained. But the lips are really what's holding in a lot of things as well. So, the lips, once they're sealed, you're going to be able to have your teeth in better position. And you get a lot less of what's going on with a lot of movement where we have teeth that are protrusive. Lips can also be affected by pushing the mandible back if we're hooking them under too. So we've got to be very, very, very careful with how we're posturing our lips, because a lot of people tend to bite or chew or suck on that lower lip, and you may not even realize it, but it's physically making a change in your face. So when it's an orthodontist referring, it's not just the tongue. They've got to worry about these lips as well. And then a lot of times you wind up with these appliances that you really can do without if you just go a more natural route with the myofunctional therapy, and like a lip bumper. So you've got this big thing jutting out in the mouth, and it's not natural. It's almost, torturous to the child, because everybody in school, children are mean. My children are mean to me. Like, I can only to other people. Like, it's terrible. Children are very, very mean.
So we're talking about, the importance of the lips being closed. So again, if we're asking our patients to keep our lips closed, it is important that they are able to breathe through their nose. So, sometimes we have to make that referral to the ENT. So if you want to talk kind of about, about that, like, getting the tonsils and adenoids checked out, or if they have a deviated septum, how you go about that. And then, also important is nasal hygiene. So if you want to share some tips with that as well, would be great.
Yes. So you don't just wake up one day and realize that you're a mouth breather, and it just happened because you felt like mouth breathing, and therefore you're going to just close your lips and now you're going to nasal breathe. That's not the way that works. In 99.9% of my cases, I always have to send out to an ENT just to get that airway clearance. If you can't breathe physiologically through your nose, you'll never get through myofunctional therapy. So it's a waste of their time. It's a waste of my time. So everybody goes to the ENT, or they come to me after they've already seen an ENT, and then, we go from there. Interesting story, personal story, is that when I first started this, I took the third child, because it's going to be difficult for me to differentiate with all these kids. I took the third child to an ENT, a very prominent one in New York City, Stephen Park. And I thought that she was fine, honestly. Well, I didn't think she was fine. That's a lie. But I thought that she would be able to nasal breathe. But there's so much that we can't see. So you think that you have the ability, but you really need a professional to go in there and to scope. When he scoped, I was surprised and really in tears to find out that she had a deviated septum. So she only had 10% of passageway for air through one nostril. And then her adenoids were enlarged, and that was completely occluding the other nostril. So this girl couldn't nasal breathe even if she tried. Like, she needed the help from the ENT. And I won't know that, not as a mom. I won't know that as a dental hygienist. You can't look in the mouth and determine that thing. So you definitely need to be screened first, because we couldn't make any progress if we didn't do that first. Luckily, we were able to make it through a natural method. Dr. Park did recommend that we did a nasal steroid for a while, try to calm down the adenoids, and then we did appliance therapy, which is a whole nother talk for another time, but we did appliance therapy to expand the palate and therefore helpfully drop the floor of the nose and correct some of that deviation. Not 100%, we knew it was not going to be 100%, but correct some of it. So it's definitely important to get all of that stuff in place first. But on top of the nasal steroid, we had to get deep into nasal hygiene. Like, it's really important. You brush your teeth, you shower your body, you need to take care of your nose. Like, it's not an option. It's something that needs to be done for everyone. We all know what's going on right now with the coronavirus, and everybody's, heightened in hygiene. So let's amp that up with our nasal hygiene as well. Saline rinses. Everybody's heard of the neti pot, and people love that. You just drip this stuff straight through your nose, but it's very important to cleanse that nasal passage. You're going to clean it out. You're going to make sure that you are helping your body help you. So even if you're struggling and you don't have full passage of that airway, your adenoids are too large, or you have a deviated septum, it's still important to keep that nasal passage nice and clean. Frequently blowing the nose. You might want to blow your nose even before you cleanse that passage, because you've got to have an open, clear airway. And then aromatherapy is superb. Like, I swear by that now. You've got to have...
My boyfriend makes fun of me. He's like, you're like witchcraft. He's like, you're concocting all these oils and diffusing different... He makes fun of me all the time. But now he's on board, and like, I love lavenders, like one of my favorite things. I could put in my facial moisturizer. I know, for nasal decongestion, we use different ones, but lavender is probably my favorite essential oil. But now he'll ask for it. Like, if he's had like a stressful day at work, he's like, can we diffuse lavender tonight? I'm like, absolutely.
usually how it works. I tell all the parents all the time, because a lot of the children that I work with, with adults, we don't have a problem. We're like, okay, essential oils, we'll do it. But with the kids, they're like, I don't want to do that. But they start out resistant, and then they wind up loving it. And they love it to the point where they're asking for it. And then the parents think it's weird. But I'm like, no, I told you this was going to happen.
Yep. Now, do you recommend a certain concoction of essential oils for parents to diffuse for their children?
I don't have a certain blend that I would recommend, but I definitely want them to use eucalyptus, peppermint if they can. Those two are the major ones for, opening up and trying to help everything just relax as far as those soft tissues. We want everything to calm down. A lot of people have issues with postnasal drip. So right before bed, if you're able to use your essential oils and you're able to diffuse something, it sometimes helps when you wake up in the morning and you don't have, as severe of this postnasal drip where you're waking up and you're like, oh, it's all in there. So it's definitely
relaxing too. I feel like every time I diffuse something, it's like if you just put on some music, it's like you're at the spa. It's great.
I don't know. I never feel like I'm at the spa. I'm always home. But yeah.
Well, I don't have children yet, so that's why.
Yeah. I don't know that you want to do that, but.
Well, thank you for those tips on nasal hygiene. That is awesome. I'm sure our listeners will love that and be ordering some essential oils of their own. Let's talk a little bit more about TMJ pain and what we hear a lot from our patients that come in, also not realizing that their TMJ is linked to everything else going on. Any tips you may have to help lessen that?
Yes. So it's really important to get involved with a myofunctional therapist for full assessment. I know that there are TMJ specialists who do lots of appliances and they will splint and open up the bite and yada, yada. But with the myofunctional therapy and knowing how functional movements do affect the way things are developing, our TMJ is a joint, it rides on synovial fluid, and we've got to keep that as, padded as possible, because that's when we wind up deviating from that ride, and then you get this popping off the joint, or you get the clicking once you have less fluid. A lot of that does stem sometimes from pushing the mandible back when you have a forward motion of the tongue during your swallow. So you're pushing your tongue forward, you're thrusting your mandible back, even though it might be subtle, as some might turn it, you're thrusting that mandible back, and you're having an issue with this TMJ over time because it didn't develop immediately over time, and it's causing you a lot of pain. Some of these soft tissues might be overworking too with these facial muscles. We see a lot of compensation and a lot of areas where people are overworking muscles, and it's causing that pressure and that tension there. So a lot of times with TMJ pain, or even grinding, I would say it's very, very helpful to do a very simple exercise where you take your tongue up, and, myofunctional therapists, we know where spot is, but you're just going to take your tongue up to the roof of your mouth, go just beyond your two front teeth, and you're going to just slowly drop your jaw until that tongue pops off. Once it pops off, you're going to go back up, and you'll do it again. Do about 5 of those, and then do a little exercise that I like to call a monkey mouth. I don't know what other people call it, because I don't know, I call my exercises whatever I feel like calling them. But you're going to alleviate some of the pressures of the soft tissues by just puffing and expanding your whole mouth full of air. So you're going to just take everything and puff it up really big and allow that to sit
Literally
there.
Look like a monkey.
5 seconds. Yeah, you look exactly like a little monkey, and it's adorable. The kids love it a lot, and then they start doing all these monkey sounds and bouncing around, and we're like, no.
Yeah, it is so fun working with kids with some of the exercises. They get such a kick out of it. I do one with them, the surprise granny face, and they just think it is the funniest thing. They'll come in here like the week after I assign them, and they'll like walk into my office doing it, and I just love they just get a kick out of it. It's so much fun working with the little ones.
Oh yes, they love it, and then they're always so excited when they accomplish something new. They're like, yeah, I figured it out. I know how to do one.
It is. It's so awesome. Thank you for sharing that tip with TMJ. Our adult patients, I'm sure, will love, to try that out. I do want to make sure we have time to talk about your book that you have out that I already read. I absolutely loved it. I'm going to read it again.
You're fast.
Oh yeah. Listen, I think I literally read it. No, I started it one night. Yeah. And I read probably like half of it. And then the next morning I purposely set my alarm earlier so that I could finish it in the morning before I had to I was so into it. I probably would have read it all in one sitting, but my boyfriend was like, all right, I think it's time to go to sleep, Brett. I'm like, all right, just one more page. I'm like the little kid who mom's monitoring their reading time. Like, okay, you got to get to sleep. But it was so great. So I recommend everybody to go out and buy this book. It is called Accomplished. So if you want to talk a little bit more about the book and what kind of made you, write it. I know I love, how much you just want to get the word out about the importance of all of this and the awareness of everything.
Exactly. So one of the biggest hurdles that we have as myofunctional therapists or anybody who's airway focused is getting people on board, because anything they don't know or don't understand is going to be the obvious hurdle that you have to overcome. Natural methods are usually misunderstood. So with Accomplished, what I tried to do is talk about it from a different perspective. So there's a lot of great books out there about this same stuff, whether it be Jaws or 6-Foot Tiger, 3-Foot Cage. There's a lot of good things out there, but it's very difficult to get through if you're not a healthcare person or you're not into it as much as, some of us are into. So I wanted to approach it from a more reader-friendly, public-friendly approach. Everybody
it totally was. Just for everybody to know, it is such an easy read. I mean, you just flow right through it. I mean, and it makes so much sense. I do always try to separate my professional mind and act as if I'm a parent or a patient reading it. And you just did such an amazing job conveying everything. It was just so
Thank you. Yeah, it was definitely to reach a general public. So it was to get them to look at it from just how is sleep impacting me? How am I not able to be as productive or as present in my daily life because of whatever's going on with my mouth? Because the mouth is so important and the way it functions is incredibly important. And functioning on full is a big thing that I like to say, is that everybody needs to function on full. We do not want to function as a third of what we could be. We want to function as 100% of who we are.
The way our bodies were intended.
Exactly. We want to show up and be present in the best ways possible. So Accomplished is out and available, and I tried to make it as cheap as possible too. So I believe you can get the Kindle version for just 99 cents. It's really simple.
Oh, hold on one second. You froze there. The Kindle copy for 99 cents.
Yes. Okay. So the Kindle version is available on Amazon for just 99 cents, and the book is under $8 if you want a physical copy of it. It's available on Amazon Prime, which is perfect. I love Prime. I'm addicted to it. Get everything at 2 days shipping. Yes, I'm ordering all the big things.
Literally everything and anything I order. It's kind of sad.
Yeah, I know. And they keep trying to discourage it.
When you're so busy, I mean, you just be able to, sometimes you order something one day, it's on your doorstep the next. Sometimes it blows my mind by how quick it's crazy. But anyways, I'm sorry. So back to, you can get it on Amazon.
Yeah, so on Amazon, just look for it. It's Accomplished. The subtitle's a little long, but it's super important because it tells you exactly how the book is going to help. It helps you to sleep better, eliminate burnout, and execute goals. And it's a fully proven process. I've done it with so many of my patients, and you get such a different aspect on it because you're looking at it from a more generalized view instead of getting too technical, too professional with it.
Absolutely. Thank you so much for all of that and all the information you shared with our listeners. Is there anything else you want to talk about before we kind of just wrap up?
I think it's really important to just put a little word out that it's not as scary as it seems. I think a lot of people do get some education or a little bit of training, but then they're not sure how to put it out there. So there's a lot of people who get stopped, a lot of hygienists who just don't know where to start, or speech language pathologists who are just really confused as to what exactly this is. It's really important to just get started. You learn a little bit of something and you know exactly what it is. You just need to get started and it'll blossom and it'll bloom and just be on a continual learning process.
That is definitely such good advice. I always think, thinking back to Kobe Bryant, that Mamba mentality. I mean, just go and get it. Work hard for it. Believe in yourself. And, the information that we have, it just can help our patients so much. So like, why hide that from anybody, or why minimize it? Like, spread it, everything I mean, let it blossom, let it go. So I'm totally 100% on board with you. I love everything that you're doing for the field of myofunctional therapy, and I just think you're a rock star. So thank you so much for coming on, and hopefully, we'll have you on again at some point to talk about some other topic.
I know. See, there's so much, and even in the book, you learn about cranial nerves and like all that. All this.
Yes, I would love to get you back on about cranial nerves. So we will absolutely have to do that, Karese. Thank you so much again. And our listeners, thank you. And again, everybody go Amazon, get a copy of Accomplished, and share your thoughts, because I know they're going to be amazing.
Awesome. Thank you so much, Brittany. I appreciate it.
Absolutely. Bye, Karese.
Bye.